Hey everyone, this is Humpday Happy Hour with Dentists in the Know. We are your backstage pass for current trends, politics, and education in the dental world. We are live again. This is over a cocktail. I think we're up to number 184. I'm so excited about that. And this particular episode is compliments or sponsored by our great friends at Shofu. And also the person you might be hearing from tonight is also someone who is closely affiliated with Shofu. Our great friend, Dr. Tom Dudney, is going to be speaking with us tonight. Great educator and great aesthetic clinician from Alabama, but we won't hold that against him. Anyway, I am joined by some of my best friends in the industry. I'm also joined on occasion by Dr. Jennifer Bell and Dr. Chad Duplantis. And as I am, we all three are dentists. We are all educators and we're all business owners. Our job is to bring all of you in the know. So welcome to my friends. Welcome to all of you. But we have a great guest, as I said. Dr. Tom Dudney is going to be with us in just a little bit. And thanks to our friend Shofu, who are sponsoring tonight's program. And with that, JB, do you have some news for us?
I always have news, guys. I can barely sleep the night before because I have so much to tell you. Are you ready?
Take it away.
Okay. And actually, most of it is uplifting, which I would like to say thank you to the community for responding to my PSA from last week, asking you all to just behave and be nice to each other. And now I don't have to spend our news segment talking about murders and other terrible things, embezzling and all the other stuff that seems to happen on a regular basis. We're just going to talk about some regulatory issues and a few odd stories that hit the news this week that had a dental twist. First off, there was a gentleman who was arrested this week. Well, actually, he was finally sentenced this week. He was actually arrested back in 2020 for smuggling money to Jamaica. He actually worked for TSA and had kind of figured out how to work the system, I would guess. And he was smuggling $42,000 in sealed toothpaste boxes. He was questioned coming through security and ultimately disclosed this. Now, the worst part about reading this story is I really wanted to know why he was smuggling so much money to Montego Bay, Jamaica, but that little gem was left out. So all we're left to chew on is the fact that he was finally sentenced for not disclosing his cash hold. And why are we talking about it on Dentists in the Know? Because he had it in sealed toothpaste boxes. In other news, the ADA, I'd like to say it's because the Dentists in the Know had a wonderful ADA episode just last week. Maybe not. But they are now accepting comment on medical loss ratio and dental loss ratio up until April 15th. There is a form on their website that you can complete where they will allow you to provide them any insight, details, or just your opinion on what you think about medical loss ratio and dental loss ratio. This is likely coming off the heels of their NCOIL and NADP agreement that they reached just a few weeks ago that did not get a lot of good press. So now they're open to receiving comments from members so that they can make sure they have all the information they need. This will go to Group for Dental Benefits and also their Governmental Affairs Council. We'll be reviewing all the comments and then doing whatever they do with their comments, probably moving it forward to the trustees and the board for review. Northern Alabama hit the news this week, and this is most appropriate for our guest this evening. If you'll remember, it's been a couple of months now since we talked about the Corporate Transparency Act. That was an act that went into effect in 2024. This act requires now all businesses to disclose to the IRS their ownership structure, particularly if they have any overseas entities or owners as part of the corporate structure. You now have to disclose that as a separate document to the IRS. This included all small businesses, including dental offices. So certainly we were talking about it. If you form a new business within 90 days in 2024, you will be required to complete the form. For those businesses that were in existence prior to 2024, you have until the end of the year to complete this requirement. Why is Alabama involved? Well, they just won an unconstitutional fight in their court system where it was ruled that this act was deemed unconstitutional by their court system. Now, this is only effective for the individual or plaintiff that filed the suit, but it might spark some continued interest and desire for other states and other entities to want to take this to the courts to fight it out to see if this act could be overturned. They cited 5 different amendments that this was in violation with the Constitution. And so we'll see where this inevitably goes for all small businesses in the U.S. And if this will continue to be a requirement, we'll keep you up to date on that. And the last little bit of news that we wanted to bring to you tonight, actually 2 other very interesting stories. The first was a woman was arrested while getting ready to be seen. She was sitting in the dental chair. She was arrested on premise for stealing someone's care credit identity. She was using their care credit to, quote, get her teeth did. And she had paid $1,000 to have access to this individual's credit line. She was arrested on site and taken in for questioning. What happened to her beyond that, we don't know. But she did not receive the dentistry that she had sat in the chair to have that day. I do wonder, though, was she already numb? Because that's like the first thing we do, right? The last story of the day, there's a study that may be coming out. It's getting its first presentation this weekend. It's a study that's looking at the benefits of CBD and periodontitis to see if it has beneficial bactericidal static effects against P. gingivalis, which we know is enemy number 1 when it comes to periodontitis. They are going to present their study this weekend, and I think it will have some opportunity for critique and review. But perhaps this may be another tool in the toolkit for fighting periodontitis in the future. And with that, that's the news.
Great news segment as always. Really appreciate you diving into that. And for those of you that don't know, JB puts a lot of work into diving into the news each week. So thank you and kudos to you, JB.
It's always my pleasure. I have my phone turned on for any news outlets that would like my services. I'm always available.
Well, should we bring on our guest?
I think we should.
We ought to.
Jeff, would you like me to do the honors, or would you
I would. If you've got the intro ready, you go right ahead.
I can't do 2 things at once, so I'm going to ask you to bring him up.
I can do that as you're talking.
There you go.
I've got an itchy trigger finger.
So I would like to introduce our guest, Dr. Tom Dudney. He's a 1977 graduate. Yes, I did say that correctly. 1977 graduate of the University of Alabama and Birmingham School of Dentistry. He served as the past clinical director for the Aesthetic Advantage hands-on program taught by Dr. Larry Rosenthal at NYU and the Eastman Dental Clinic in London. Presently, he is the clinical director of the Pacific Aesthetic Continuum hands-on program. In addition to teaching hands-on programs, he's presented workshops and lectures at dental meetings and has authored several articles on aesthetic and restorative dentistry. He's a member of the ADA, the Alabama Dental Association, the American Academy of Cosmetic Dentistry. He is also a fellow of the American Society for Dental Aesthetics and a diplomat of the American Board of Aesthetic Dentistry, as well as a member of Catapult Speakers Bureau. So, Tom, welcome. It's awesome to have you.
Thank you, Chad. It's great to be here. If I had any idea you're going to read all that, I'd have told you, forget it.
You know,
it's bad enough to read it, and then I have to sit there and listen to it. I go, why couldn't you do the short version?
Hey, man, it's
here's Tom.
Well deserved.
JB, that would have been more than enough.
Right.
And before we start, can I just say one thing? Because we all have to talk and we all have to do what we do, but I am okay in a lecture environment. If I've got a clicker in my hand and a PowerPoint screen behind me, and I can look up there and I can talk all day, whatever picture happens to be up there. But to look into a camera and talk like that, Jennifer, I'm blown away. My news crush
Thank you. Oh, yay! Y'all just heard that, right? Write it down.
Jennifer
Write
has
it
a
down.
favorite
None of the blonde Fox ladies have anything over you.
That's right. I don't even have cliff notes. So yeah.
No, I'm telling you,
No
that's one of the most
or
amazing
obviously
things.
a makeup person.
I'm sitting, yeah. Now I'm sitting there watching, and I'm saying to myself, this is very impressive because you are a seasoned pro, is what the people you see on television. And it's just not easy. Somebody try it sometime. Just look into a thing and just start talking, because it's not easy to do. Carrying a conversation is okay, but when you're having to do that, anyway, get on with your show. I just had to say that before we started. I'm very impressed.
I genuinely appreciate it.
I think that was well deserved too.
Yeah. That was pretty awesome, Tom. I appreciate that. But hey, I want to start tonight a little bit differently than we had originally planned, because I've known you for several years now, Tom, and you know, we always have great conversations when we're together. But you did something in Chicago that really kind of took me, because I'm kind of in the same boat right now.
Right.
And I don't even know that you did this, but I'm sure that Jeff and JB noticed it also. You have an associate in your practice.
Right.
And the one thing that you did is you brought your associate around, you introduced him to everybody. And to me, that was really cool. I mean, there's obviously a very unique connection there. You're very proud of the practice that you have. You're very, very proud of having the associate in your practice. And I know that a lot of dentists are going down this road right now. How did you find your associate, and you know, where did that relationship come from? Because, you know, I don't know if you noticed it. It's pretty cool. We all saw it. We all noticed it.
Well, I appreciate that from all of you. Sincerely, I will tell you, it was just luck. You ever have these, like, you know, what's that saying? Even a blind hog finds an acorn, or whatever, you know, it's just, he answered an ad. I needed an associate, and with some help with some people, put an ad in. He's down in South Florida. He's Cuban. So born and raised in Cuba, was working in South Florida. He went to UAB to dental school, to my dental school. His wife is in Birmingham in hygiene school, and he wants to get back to Birmingham. And he saw the ad needing a dentist in the Birmingham area. He answered the ad, and we hooked up and hit it right off. But I just got real quickly, without taking up too much of your show. The amazing thing is that I didn't know him. He didn't know. It was just the two of us just met, you know, got put together. But, you know, I've taught, you know, live patient hands-on programs for years. I got involved, like you said, with Larry many years, 25 years ago. So that's where a dentist brings a patient, and we're teaching anterior aesthetics. So it's porcelain veneers, and they bring a patient. And so you get to watch, you're in the clinic, and you watch these people prep, and you watch them take impressions and make temporaries and seat cases. So you're really get to see a lot of dentistry, and of all different ages and all different abilities. But Luis, my associate, is as good as I've seen. And the kid is he's amazing. He has great hands. He cares about patients. Being bilingual is cool, because we get Hispanic patients now, and I'm walking down the hall and I hear this, you know, just, you know, really, really fast Spanish going, and the patients just love it because they're conversing in their native tongue. But in addition to that, I mean, he does root canals really well. He places implants really well. He does a lot of stuff I don't do. And he, you know, when he first came in, every time I'd have any kind of veneer case or anything aesthetic, he's in my room watching, just like a sponge. So I've been very fortunate to have someone, and he cares. I mean, he wants to work hard. You can't work him too hard. So I would wish on all people that they would be fortunate if they're looking for an associate to find someone like him. It's been a great relationship.
Where did you place this ad?
Okay.
Just out of curiosity.
So here's the thing. So I'm working with a group of people, you know, that's called Freedom Dental Partners, that are selling my practice. Okay.
Okay.
So when I found out I had to have an associate, you know, private equity doesn't want to buy a practice with one old dentist in there. Okay. Mm-hmm. They're worried that they're going to, you know, buy the practice, then you're going to, you know, head to the beach or something. So they want an associate in place. And so they had a system, and they placed ads all over the place. They placed them in journals. They placed them everywhere. It's kind of a turnkey operation that they had. So I would have been in the local dental stuff, I wouldn't have known. I mean, he's in South Florida. They had ads everywhere, and he saw the ad in South Florida. So that's how it happened.
Wow.
And so it was very, very fortunate for me. It's just one of those things that, it turned out good. But I'm very, very happy. And we went to Chicago. He wants to learn. He wants to get better. I want him to meet people and, and get to, because he's like a sponge. He's just soaking up stuff. And that's real exciting for me. I see it because when I was young, he reminds me of me when I was a young dentist, wanting to learn and appreciative of an opportunity to learn and learn from really smart people. And people ask me, when you lecture, what do you lecture? I say, well, I just try to teach what other smarter people have taught me, what I've learned from them. So I'm not really giving them new information, I'm just passing on things that I know or I've learned. So yeah, it's been great.
Now, so I gather that part of your quest with an associate is you're developing an exit strategy.
Yes. I would like to. I mean, I'm getting up in age. I want to work. I still like working. I mean, I still like, I know you said you put 15 units in today. We put a big case in yesterday, and I like doing that. And listen, I can prep teeth all day long. I mean, but anytime, I don't care how many times you've done it, when you're seating multiple units, there's always a little bit of a fear factor that's going to go on. You just can't, because you don't know what it's going to do. I mean, you have control of your ability, but I heard Jennifer talking about that case you just did, and kudos to you on that, but especially when it's thrust into your lap. But it's when you're dealing with stuff like that, you don't have control of that. And it's not as good a feeling as when you're in the pre-planning stage and you plan it out. But, that's the kind of thing that I still love doing this. And I want to work for a while. I'm not, as long as I keep feeling good and I'm trying to stay in shape because I want to keep working. I wouldn't know what else to do. I'll be honest with you. I don't have a lot of hobbies. I don't do a lot of stuff. I mean, I like traveling and stuff, but I mean, how much of that can you do? And my wife doesn't want me in the house all the time. So she's glad I get up and go to work. She doesn't want me around all day long. So I want to do it for a while, but I do need an exit strategy. Nobody wants to, be the boss and pay the bills and everything their whole life, That's something that I would like to do. I'd like to be able to come to work and say, what I got on the schedule today, and not care. Hey, good day, bad day, doesn't really matter. Now when you're in control and you run the ship, everything matters. And it'd be nice to not have that. And I can get over to Nashville and play golf with Chad over there.
Yeah.
It's what our plan is.
Tom, I've got a question.
Sure.
You've been in hands-on education for a long time. You worked with some of the greats, and you are one of those. But I know one of the people that you worked with in the in the New York program, Dr. Larry Rosenthal. For those of our younger viewers, really a huge pioneer in cosmetic dentistry, and but the teaching style back then. So I remember seeing Larry Rosenthal in the 90s. And a lot of the teaching style was it was a very how do I put this without dissing Larry Rosenthal, because he's an incredible clinician, but it was very much I'm going to do whatever I need to do. And sir, what do you do if the patient asks you this? And Larry Rosenthal's answer would always be, I just tell them I'm going to do whatever I have to do. And that's a very different style. Like, patients are coming in much more educated now about what we do. And I also think that dentists are coming in and not wanting to be educated by someone who says, I'm really great at this. You just need to suck this all up, and one day you'll be as good as me.
I understand.
It's a different teaching style.
The thing, Jeff, I think we all adapt and we all change. Now, I haven't taught with Larry in years, but I would bet any amount of money that Larry has adapted and he's changed, and his teaching style, because they still, Aesthetic Advantage is still taught in the spring and the fall. They still have 2 courses a year. And I would bet you their courses have adapted to more modern times, like you said. But when in the 90s and the early 2000s, when I was learning from him and teaching with him, it was an incredible education in aesthetics. He was a tremendous dentist with an aesthetic eye, and he really knew what it took to make smiles beautiful. But he also understood patient education, and he understood, how to treat patients and treat. I mean, his whole philosophy was 5-star product, 5-star service, and 5-star service was just as important to him as the product you delivered. And he wanted his patients to have an experience like going to a spa or something like that. That's kind of how he was. He wanted to be like a 5-star hotel in New York. So that was, to me, I didn't get that. I'm going to do whatever I want. That's not the way.
But no. Let me say that differently. It was because I had seen him on several occasions.
Yeah.
And it was, when questions would come up in the coursework, or what do you say when your patient asks this, or how do you explain what you're doing or why you're doing this? Right. And, his famous comeback was, I tell my patients, I'm going to do whatever I need to do. You sit back, relax, and I've got you. And he could be that confident because he was that damn good.
Yeah, he was. But
we would have a hard time, most of us, in talking with our patients that way.
You bring up a good point. And so when our courses, one of the best things I felt that dentists would learn is that if you didn't do a lot of veneers, you weren't real confident, and patients can sense that. Even if they're not dental educated or dental knowledgeable, they sense confidence. They can tell it in you. And the more of this you do, the more confident you get. Patients sense it and they trust you. So I think what he had ultimate trust. Okay. He was so good that he kind of exuded it, and the patients knew it and they felt it, and they usually would come on a strong recommendation. So he could probably get away more than others. But I think a lot of it, Jeff, is just like you have. If you're treating somebody for sleep, I guarantee you your confidence level is through the roof, and your patients are going to know it and sense it. And people are going to refer people to you because they know that and they trust you. So I think a lot of what we do is about trust and developing that trust. And I have patients that come to me that have a regular dentist because they've heard that, he may be pretty good at that. I don't put myself in the category of a Larry Rosenthal. It's nice of you to say, but or even like the Frank Spears and the John Coyces of the world. I've learned from them, and I try to mimic them in things they say and do. But I'm just a guy that learned from them and try to help other people. And I love talking about it. That's one of the reasons I like teaching and lecturing, because I enjoy it and I like talking about it and I like sharing ideas, and I like, I love learning from people about neat things. So if I have something I think might be of value, I like sharing that with other people too. And like, in any way that can help them. But I think anything we do, we get better at. And as we get better, we develop a confidence without being cocky or arrogant or anything. It's just a quiet confidence. And patients sense that in the way you talk, in the way you present, and the way you discuss their treatment. And if they ask you, fortunately, most patients don't care. They just want to know that they're in good hands. And they just want to know that you're going to be able to help them and take care of them no matter what you're doing. So that's kind of how I would answer that. But yeah, I learned early on from some really, really good people. And I'll tell you one last thing really quick, because I don't know how much you want to talk about, but teaching, one of the best things for me is it really woke me up. It was a true awakening, because now when you're in your office and you're on your little cubicle and it's just you and your assistant, your patient doesn't know what you're doing. They don't even know if you're any good or not. That's pretty evidenced by some of the stuff I've seen that's come in. So, but when you're teaching another dentist, you're not going to pull the wool over their eyes. You're not going to, they know, if you know what you're talking about or not. So when I started teaching, I had to really start learning, and I had taken CE and stuff, but I became very serious about becoming a better dentist, because I couldn't be a dentist teaching other dentists unless I knew what I was doing. So I think that was probably the biggest factor for me, was that I honestly can't say that I would have been that motivated if I had been teaching other dentists. I mean, maybe I would. I always felt like I wanted to learn, but it was a true motivation that we don't all have. I mean, that I know the four of you do, but I mean, the three of you do, but not all dentists have that.
You're absolutely right. In order to teach, you have to be a student as well. And I think that I think all of us would agree that, especially when it's a presentation that you're given for the first time,
Yeah,
you better know at least most of the
100%.
answers,
Yeah, you
and
better.
if not all of them,
Yeah.
most of the answers, and you better have a
Right.
contingency plan for when you don't.
Well, yeah, and you're like, we're doing hands-on, they're prepping a tooth, and they look up at me and say, "Is that right?" You know, you gotta know. I mean, yeah, you gotta be able to show them if it isn't right. I mean, you
Mhm.
literally gotta be able to sit down and do it right. So these are the kind of things. And then like occlusion. I'll use occlusion as an example. I mean, I didn't learn occlusion in dental school, and I didn't really need it. I was a tooth by tooth dentist. So early in my career, I was doing single tooth quadrant dentistry. You don't really need to worry about occlusion with that. We weren't doing big cases. We weren't doing things that could, be affected by bites and stuff. But all of a sudden you're teaching these courses and you're doing 10, 12 restorations and things like that. And now occlusion becomes really important and you have to understand it. And I'm in a course, and Tom Trinkner was in a course with us, years ago. This is way back, when I was taking a course with Larry Rosenthal and Bill Dickerson, and Tom was in the class, and he'd been through Pankey. And he's sitting down there and he's talking about canine guidance and posterior disclosure. I mean, it's just all the stuff that, is fairly common knowledge now. But I mean, I'm going, what the heck's he talking about? I'm going, he's saying all these terms and talking about all this occlusal stuff. And I said, you better get busy, and you better get off your butt. You better get out there and learn some of this stuff, because you're going to be teaching dentists who are going to be asking you these questions. And so you need to know what you're talking about. So that was a big, big, big help for me.
All right. Totally off topic, because actually one of the first ways I was introduced to you was on social media, which you would never know. But
were you on Tom's OnlyFans page?
Yeah.
Yes.
No, he was probably my only fan.
Very good. Well,
he's
done.
quick.
Listen,
he's quick.
Quick. Yeah.
There's no top. This is like, I love this format. I love this just freewheeling.
That's awesome.
This is great. You can go any direction you want. You can ask me anything you want. There's no such thing as being off topic.
My only fan.
You're my only fan. Not my only fans, my only fan. Okay, I'm going to ask a question. So I first learned about you through your Whitening for Charity program, and I was really struck by it. And I would love for you to tell our audience a little bit more about maybe what motivated you to get started, how that works, because I do think a lot of dentists are curious how to incorporate philanthropic activities into their daily practice. And then what are some of the benefits of the program for your community?
That's one of the two cool things we did. And I'm going to try to keep this really short. So have you heard of Crown Council?
Yes.
Yeah. So Crown Council, okay. Well, they started, and right at the very beginning, I read an email where they were coming up with this idea to do whitening to benefit children, handicapped children, disadvantaged children, things like that. I said, and I don't like doing whitening. I have never looked at whitening as a profit center for our office. We did it only if patients asked us to. So I've never been a fan of whitening, but I said, well, we're doing it almost for free anyway. Why not do it and get some benefit out of it? Mm-hmm. So the very first year they started doing it, but of course you have to be a Crown Council member. So I was busy teaching, doing all these things. And I know it's a great organization. They do so many wonderful things. I joined just so I could do the whitening. And I've been I don't know how it's been, 15, 16, 18, however many years it's been, we've done it every year. And they have now raised, I think last count it was like $46 million. Everything's donated. All the time's donated. There's no middleman. There's no money going to anybody. Every dollar raised goes to charity. And 50% of the money we keep, we designate for a local charity, and we do Smile a Mile, which benefits children with cancer here in Alabama, in our area. So this is something that's meaningful to me. And then the other 50% goes to national and international worthy causes and things like that. So that's been good. I'll tell you a really neat thing for your viewers and listeners. We partnered with a radio station. They're they've got a very have high ratings, and they're syndicated in multiple states. And we did a veneer makeover several years ago, and we started doing one for mothers on Mother's Day. So their listeners submit a letter either from a child or a relative or why they should win the mother's makeover, and we do a smile makeover for these people. We do one every year at Mother's Day, mothers, and you get some great letters. Some of them are tear jerkers, and we try to pick. So our office will pick the 3 finalists, and they put them on their website, and they vote for the viewers all vote for who they think the winner should be. Then they come in and they get their smile maker in our office. Then they get to go on the radio station, and they go on the show, and they talk to them and talk about their experience and stuff like that. So there are other things that we do, but I really was happy to hear you say that, because I don't consider it a big deal. I consider it something that dentists do. And I am very careful if I'm on TV or if I'm on the radio, I say, listen, I appreciate you saying this, but there are dentists out there everywhere doing these type of things and not getting recognized for it. Dentists are very good about giving back, and they're not always, get the publicity for doing that, but a lot of them don't care. I mean, we don't do it for the publicity. We do it because we want to help somebody. And so it's kind of a neat thing. So Crown Council, you're a member of Crown Council, you can do the whitening. It's from March. It starts March. It just started. It runs through the end of June. They supply all the bleaching materials for you. You don't have to pay anything for that. And it's just a really neat thing. And we usually do it we might do it for like $200 or something. It's usually a discounted fee. And so the patients get a good deal, and 100% of the money they pay at a discounted fee goes to charity.
That's awesome.
Sorry, that was an awful long answer.
No, it was wonderful.
Yeah.
Yeah, I think that's fantastic. And what a great way to not only get involved in your community, but to give back a little bit too. And I love the charitable causes that you're giving, what you receive off of it too. That's what it's all about. And I think sometimes a lot of dentists get caught up in their own stuff that the majority of us give back. I know some of us are even looking for ways to give back, but it doesn't always have to be going out of the country on a mission trip, although that's absolutely fantastic.
No, that's
and I
great.
support anybody that does that.
Right.
There's a lot that you can do out of your office,
Right.
and for the people of your community that would be just as beneficial as going out of the country.
100%. I mean, you can't do it all. You have to pick and choose. Otherwise, you'd be overwhelmed. And we get a lot of letters because they hear about us on the radio. I think the only thing I know is that when we were in Chicago, Chad asked me about, how we use Shofu's flowable composite to put veneers on. And he asked me, did I do that? I said, yeah, I've been doing it for a long time, and I really like it. So
I want to know about it.
Yeah. And that's something that I wanted to talk about, but I think,
do you have time?
I think we got to peel back the layers of the onion first,
Okay.
I mean, and figure out what Tom's all about. And that's where I wanted to head, because we can tell everybody how good of a dentist you are, but I want everybody to know how good of a person you are. So that's where we're headed first.
I think everybody, to me, again, how good of a dentist you are. I think if you love something and you're passionate about it and you really care, you want to be good. I think anybody can be good. I say it all the time. If I could do it, I tell people in my classes, if I could do it, I know you can do it. If anything I could do, if I can do a full mouth rehab case, which early in my career, I never thought I'd see these cases. I said, well, I could never do that. But then I found out, it's not that hard. I just thought it was hard. When you learn how to do something, you realize it's not that hard. And when you care, when you want something to be good and you want it to look good, you find out, I can do this. Because when it boils down to it, and when you get right down to it, there are things we do that are hard. That case Jennifer just did, that's hard. Okay. What I do most of the time, it's not hard. It's not hard to do. So most of the stuff we do, it just comes with, and experience is a great teacher too. I tell people all the time, getting old is no fun, but one thing about old age is that you've got a lot of experience and you've had a lot of chance to learn and grow and get better. And repetition, there's that whole Outlier book about repetition, how people got so much better through repetition by doing things over and over and over again. Well, when you prep hundreds and veneer preps over and over and over, you get pretty good at it. You're almost doing it in your sleep. I probably shouldn't say this because we teach depth cutting burrs in all of our courses. And I tell every dentist you should never prep a veneer without doing a depth cutting burr. But I swear with my loops on, I know what 0.5 of a millimeter of a prep looks like without a depth cut, because you've done it so many times.
Mm-hmm.
But, years ago, I wouldn't have thought about trying to prep a 0.5 millimeter depth without a depth cut.
But Tom, where does that come from? That comes from using the 0.5 of a millimeter
over and over and over
again, and then
right.
what it looks like.
Yes,
and
exactly.
So it's that same repetition thing you were talking about.
Yeah. So we all, if you want to, anybody who, there's no excuses. What I'm trying to say, there's no excuses. If you want to be good, you can be good. Okay. Especially if you're wanting to learn and keep getting better. Now, there are some people that try to do too much, and I think they spread themselves thin. And then there's other people like Luis that it doesn't seem to affect him. He seems to be able to do a lot of things and do them all well. I don't think I could do that. I think I want to try to concentrate on one thing and be really good at that. But he seems to be able to be really good at multiple things, and I couldn't be happier. I think it's great, and I love being able to work with someone like that. Let me tell you, it's nice when you have a patient that's in and they have a toothache, and instead of trying to get an endodonts, we can do it right now. And that's how he is. He can have two patients. If somebody's got a toothache, he'll say, well, I can see you right now. It's just a great attitude. It's just like, he doesn't want to make people wait. Doesn't, somebody's hurting, they need something, boom, he can do it. And, and I'll tell you another thing too. You mentioned CBCT, or I guess Jennifer mentioned CBCT. And I'm going to tell you, we're seeing things now. Oh, no, you mentioned it, Jeff, on the case you found. Yeah, you were talking about it. You found something most things would never see, okay, with routine x-rays. And so we're doing cone beams now because he places implants. But I'm finding stuff, we're seeing stuff, and he's getting really good at reading them. So we're seeing things we normally wouldn't see. So I'm a big fan of them now, and I am convinced that it may not be the standard of care, but it won't be long until, because what's our ultimate goal? Our ultimate goal is caring about our patients. Our ultimate goal is delivering the best treatment for our patients we can. And if this allows us to do that, man, I'm not saying if people are listening to you, run out and buy a cone beam. That's not what I'm saying. But I'm saying if you have the ability to get one, they're really, and I wouldn't have known this until we started looking and seeing all the stuff we see on them. I just thought I'd throw that in there.
No, I mean, that's great information, Tom. And it's great when we get to hear people that, have recently brought on that technology,
right?
How much they enjoy it, and the things that they're getting, and how it's benefiting the practice, quite frankly.
Right.
But let's pivot for a second. I'm using one of Jennifer's favorite words. Let's pivot for a second, because Chad alluded to something earlier that I would like to touch upon, which is we all have a common bond in that we have all been KOLs for Shofu dental products.
Right.
And many of their products, which, again, most of the companies that I think for all of us that we have been key opinion leaders for, we've actually used their products way before we were ever key opinion leaders.
Right.
It wasn't them asking us to come, talk about their products.
Right.
And there's a reason why companies like Shofu, have people like a Chad Duplantis and a Jennifer Bell and a Dr. Tom Dudney, all, using their products. So maybe if you could, this is one of the things that I really wanted to hear tonight.
Right.
If you could talk a little bit about what it is about, some of their key products that you use in your practice every day, and why you use them, and how it fits into, I mean, obviously everyone knows what a great dentist you are, how it fits into delivering that high-end care.
How much time do we have?
I know the feeling.
What do I have? 5 minutes? 10
you have
minutes?
all that you need.
You have what you need.
All right. So here's the thing about,
like Larry Rosenthal says, whatever it takes.
Whatever you need, I'll do. So I love I work with a lot of companies. Okay. I love Mike Gainsbourg has a great, the president of Shofu. He has a great, and he took over Randy Bailey, who was a phenomenal guy. And I loved Randy, and I loved working with him. And it helps when they have good products, and I do use their products. But he has a great attitude. He says, listen, if you use our product and you like it, that's all I want you to talk about. I don't care if you use other people's products. And I know there's other companies that have good products. And so he gets up and he says that, and he lives that. So I like companies with that kind of attitude, because when I talk about Shofu and I talk about other products, it doesn't sound like I'm just doing a commercial for them. It sounds like I like a lot of different products. They just happen to like theirs. So real quickly, let's start. I'll leave the Beautiful Flow Plus for last because it's the single most versatile product in my entire office. But their new camera, their camera started the eye special. What's that?
Side pack, yeah.
The eye special C1, the eye special started with 1, then it went to 2, then went to 3, then went to 4, and they just introduced 5. So this camera, just real briefly, is a neat camera. It has 9 shooting modes. It has all different kinds of stuff on it. It's self-contained, so you can wipe it down with, the little sterile wipes and stuff. It's easy. It's lightweight. Your hygienist can do it. It takes great photography, just as good as a Canon or a Nikon. And what I showed up, so we just had our Catapult retreat, and Shofu was one of the sponsors there, and they had 2 hours to talk. And instead of doing that, Mike said, hey, listen, I'd like you to talk a little bit about our pink composite. And I said, well, I'd be happy to do that and show some stuff. And he said, but he didn't ask me to talk about anything else. But I also put in there a couple of slides about a camera, because we use the Isolate Shade for shade matching. So we had a patient who was a Channel 13 weather girl. So local weather girl, she's on TV every day. She's pretty smile, but she had an endo tooth because she had trauma as a child and had a crown, and the crown was getting, older and wasn't looking good and wasn't matching in color. So she wants to redo that crown, and she's got pretty teeth. So we ended up doing a crown and a veneer, a crown on 8 and a veneer on 9. So we could match the 2 centrals and get a shade. Well, we use the Isolate Shade mode on the camera, which grays out all the pink, and it gives you a really good look for value, and it helps the laboratory. So that's one thing, but they've got a lot of different shooting modes. It's a really valuable camera. We also can do intro photography with it. We could do, it's great for patient education, where you can do a full arch and show a patient, their entire arch, and, how bad their teeth are, and, why we're recommending all this work. So I talked about that. Their pink composite is their gingival 2 pink is kind of neat, because you ever see those classes? I mean, those class 5s where they'll have, say, like an upper canine with gingival recession and the gum goes up. Well, you do a class 5 with a tooth colored flowable composite. Now you got a really long white tooth. So what you can do is you can do the white to the CEJ, and then you do the pink from where the white is up to where the gingival margin is. And because they have 5 shades and you can kind of customize them by mixing them together, you can get a really good match with gingival color, and it keeps the tooth from looking really long. So there are a lot of uses. I use it in restorative cases where maybe you've had trauma, extractions or something, where they have a large defect and there's not enough bone to do an implant, but they're going to have a big gap right there, maybe a high smile line. So we'll do a restoration, and then we'll do the pink composite in there to. So we show some cases like that. We talked about the composite, the pink, the camera, and then I talked about Beautiful Flow Plus. So Chad had asked me, didn't you see veneers with it? And I said, well, this is how it came about. We were doing a live patient course at Greater New York Dental Meeting, and Randy Bailey had asked me what I do. Shofu was sponsoring a live patient, and the Greater New York, where you're up there on the stage and you demonstrate something live. So he asked me,
it's your pants down on a big stage.
Yeah, exactly. So would I be willing to do a live patient? I'm sitting there going, what do they want to see? Do they want to see me do a composite? I don't like doing class 2 composites, so I rule that out. A crown prep, I said, that everybody's doing that. That's no fun. So I'm searching my brain. I'm trying to think of something. I said, I know, I'll seat veneers. I said, because that's something we're all stressed. I don't care how many you do. It can be a stressful appointment. So I thought if I can show them, because we have a way we do that I learned how to do in our courses, which I feel, rubber dam isolation, all that thing, putting all 10 in at one time. I said, well, that'd be something good to do, but they don't have a veneer cement. So I thought, since I'm using Shofu, I want to use as many products as I can. So I decided to use Beautiful Flow Plus. They didn't have X yet. They've since Beautiful Flow Plus now has a smaller particle size and is highly more polishable, and they call it X, Beautiful Flow Plus X. I just call it X because that's too much to say. So we're using the Beautiful Flow Plus, which is a flowable composite. is basically a veneer cement. It's a lot like veneer cement. So we seated our 10 veneers in Greater New York meeting. I don't know, there's like 800,000 people out there. Those programs are well attended. And then I found out why. First, I thought, oh, they're here to see me, screw up, which was probably part of it. Okay. The other reason is it's free. And you got to pay for all the other lectures. So there are lectures they charge for, like $200 for a 3-hour lecture. And when I saw that, I'm doing a lecture, I'm saying, I wouldn't pay $200 to hear me for 3 hours. I can't believe people are in this room. I can't believe they're coming in here. So the live patient demonstrations are free. So, and they're on the exhibit floor where there's already a lot of people anyway. So, but there are all these people. I'm looking out in the audience and I'm going, my God, there's all these people out there. So luckily you're up on stage with all these lights and you just kind of forget it. You got a mic on, you're talking. So we seat our 10 veneers. And I have to tell you and tell your people, I hedged a little bit. I used my hygienist as my patient because I knew her gums would be healthy and she wouldn't be bleeding. And I knew that I could get the veneers and try them on before we went to New York. So I made sure they all fit. So we took our temporaries off, tried the veneers on, put the temporaries back on very lightly so they'd come off real easy. And her gums were perfect. They didn't bleed. So, I fudged a little bit, but it was still fun. And we used the beautiful. And so I've been using, and another thing I'll mention too, Shofu has a patented Gymer technology. And as I'm sure you all know, Gymers is 6 beneficial ions that are released and recharged from all of their composites. And so I feel like when I use this flowable to see, plus it has 2 flow consistencies. It has a low flow and a no flow. So if you want it to really flow, you use the no flow. And then, the low flow, and then the no flow, it's more stackable. So but there's some extra benefits and the colors are nice, so you get a nice shade with it. So there are a lot of benefits, I think, but the ion release, I think, is a pretty big deal. So, I still use it in my practice, even from that time forward. So that's how it came about, Chad. And that's why we used it only because that we used it instead of a traditional quote veneer cement from another company. But I since have started using, I can't tell you. You can use it. First off, it's Beautiful Flow Plus and Plus X are both can use for all classifications of restorations, 1 through 4, class 2s, MOs, MODs, things like that. You can use it a liner underneath a paste type composite for proximal boxes and floors. You can use it as a total restoration. You can use it anteriorly. It polishes nice, so you can use it in anterior restorations. I love it for class 5s. It's probably my favorite. It's fast, simple, and easy to do on class 5s. I love it for class 5s. And then class 6s are cuss tips and incisal edges. So in erosion cases and where you see teeth, molars with these little potholes in them, that's from erosion. So what we'll do is we'll put a rubber dam on, isolate it, no anesthesia, and we just etch it or micro etch it and just bond some flowable to it. It's fast, simple, and easy. They're so easy to do. And we could do some of those. Sometimes we do 3, 4, 5, 6, or 8 of those class 5s at one time, from abrasion, and you get those, we call them NCCLs. We used to call them fractions. Non-curious cervical lesions is the accepted term now for these class 5s and these little wedge-shaped lesions at the CJ. And we, sometimes you'll see multiple in a row, and we can do them fast and simple and easy. So I love the flowable for that. We had a case where a little boy was horsing around with his sister. He fractured off half of his tooth. The mom came in with the piece. It's called a fragment reattachment, and we use Beautiful Flow Plus to reattach the piece, and it's still on. It's been 6 years, and he had a pulp exposure, and we did a pulp cap. We used Theracal to pulp, viscose Theracal to pulp cap it, and then we seated it back with we etched it, bonded it, seated it with Beautiful Flow Plus, and 6 years ago, the pulp's still vital and the piece is still on. So, was a kind of a neat thing. We use it for mock-ups. We use it for provisional repairs. If sometimes you get voids or bubbles in provisionals, you can use it for that. I love doing diagnostic mock-ups directly on the tooth, and that's where the no flow comes in, where it's more stackable. Let's see. I was trying to think of all the uses there. You can bond out orthodontic brackets with it. You can use it if you're doing internal bleaching and you want to block out at the bottom of the tooth there, so you won't get bleach into the canal. You can use it to seal that off. Gosh, that's pretty. That's now
It's
you
an
know,
extensive list.
it's
Yeah,
such
yeah.
it's a
It is an
versatile
extensive list.
it's a versatile material that you can use in so many different clinical situations that we use it all the time, and it's a go-to product for me.
Well,
And by all intents and purposes, it's bioactive too.
Yes. Well, so here's the thing. There's only, a lot of companies can't really say it, but Pulpton and Shofu can, okay? When ion release, there's a lot of ways to define bioactivity, and I think we're going to get more and more products we're going to see going in that way, because I just think that there's benefits there. Calcium release, fluoride release, these things are beneficial. So, and the rechargeability, I think is a great benefit. But I think we're going to see more and more manufacturers getting into this because bioactivity becomes a bigger buzzword. But yes, if you want to use the definition that ion release and fluorapatite formation, technically makes it a bioactive material. So yes, I would agree with you.
So, Tom, I think you summed it up, which is, first of all, most people don't think of Shofu as a restorative company. Most of us, especially people our age, right? We knew them as the polishing company.
Yep,
we didn't think of them as the restorative.
I knew that's what you're going to say. You're absolutely right.
Yeah, well, certainly from our generation.
Because they had great polishers.
Yeah, and the polishing is phenomenal. That goes without saying.
Right.
But the point is that they are making some of the premier restorative materials right now with bioactivity at an extremely reasonable price, which is why so many people are using these options right now. So, just with that said, we're getting to the end of the show, so we kind of have to close this out.
I understand.
But I think you touched on so much in what you said. Right. And we appreciate that very much.
Yeah. And I'm glad you mentioned that, because, we don't talk about that enough, about the price. And Mike gets really frustrated because they can't mention, but they are very, very reasonable. For the quality of the products, their pricing is extremely reasonable.
Right. You're not compromising the quality. That's the thing. No, in fact, you're getting bioactivity, which most of the other companies can't say.
Right.
So, yeah, it's definitely something everyone should look at.
Right.
And again, I put this out there because at Dentists in the Know, we are not about pushing products at all.
Right.
The companies that we have worked with for years and years and years and have come to love, those are the companies that support us now and support great clinicians like you, Tom Dudney.
Well, thank you, Jeff. I appreciate it. You guys are doing an awesome job. I'm so happy you asked me, because now I know about you and I know what you're doing. I kind of knew tangentially what you were doing, but now I have a really good idea, and what a service to the dentists out there. You guys are to be commended for what you're doing. And I don't know if that link will allow me back in just to listen, but I'd love to hear your show again.
You're never allowed back. I'm sorry.
Oh, shoot. Yeah. I just want to hear the newscast.
You've been cast from the island. You know what? Jennifer's newscast is a separate Instagram entity. Okay. You can follow her.
I'll follow her. Okay. I'm going to do that because I'm a fan of the newscast now. I got to tell you, Jeff and Chad, I love you both, but I got to tell you, I'm a big fan of that newscast. I want to hear more.
I love it.
Thank you so much for everyone for coming out tonight to my fan party. Really appreciate it.
Let's all go have a drink.
How you feel, Barbie?
Yeah.
I feel pretty good right now, Mike. My bubble's pretty big.
Right,
Maybe we'll get humbled tomorrow. No fear, everyone. I will screw something up at work. Don't worry.
No, you won't. I doubt that.
Chad,
I'll close this out. And you said something earlier that just kind of hit me, and it goes back to a comment you made earlier. I'll follow it up with this: is that, for those of you that don't know, I like to play golf, and I think it's really important that I have a coach. And a couple of weeks ago, I was with my coach, and I wasn't hitting the ball really well. And I said, I bet you have some people that you teach that just really suck at golf. And he looks at me and he goes, it wasn't the answer that I expected, because he goes, nobody sucks. We just all have varying abilities. And when I was listening to Tom speak earlier today, he said, if I can do it, then you can do it too. And I know that that is what makes you a great teacher. I've never heard any bad. I've heard all good from your courses. So if anybody's out there and looking for somebody to teach them the right way and a way that you can truly learn and become successful at it, look no further than Dr. Tom Dudney. So thank you for being with us tonight, Tom. Really
pleasure,
appreciate
Chad.
you.
Hey, are you allowed? Are you allowed? I didn't even think about this too. What you just said, are shameless plugs allowed?
Absolutely.
100%.
They're encouraged.
Okay. So we're starting a live patient hands-on program at UAB Dental School with Nate Lawson and Augusto Robles.
One of our faves.
We're going to be teaching live patient, and we're trying to get a spring program. We definitely have the fall program set. If we can get enough dentists in the spring program, it's in May, and the second weekend in May and the last weekend in May. So I just throw that out there. If anybody's listening, you mentioned something about teaching, and we would love to be able to teach these people anterior aesthetics in a hands-on environment. So,
Love it.
I appreciate you allowing me that opportunity. I don't like to talk about something I'm doing, but I think it could be a beneficial program because, Nate and these guys, they're phenomenal. They'll be at the dental school. So it's a dental school environment where you really have a good learning experience. And as far as golf goes, the best lesson I ever got was I was playing years ago. I used to get really mad. And I was playing with a golfer that was pretty good, and I got mad about something, missed a putt. I don't know what it is. He looked at me and said, "Hey, let me tell you something." He said, "You're not good enough to get mad."
Yeah, that's true.
And that stuck with me. He says, "You're not good enough." He was right. Why should I get mad at something when I'm not? You're not that good. So you should, anyway. You guys are great.
Hey, Tom, do you have a link for the course that we can post later?
I will get it to you. Okay.
Yeah.
Yes.
I will get it to you.
We already have
people
people asking about the price.
So
and I would definitely get you a link so they can get the whole thing about we've got a whole flyer with all the information about the course.
Perfect.
On it, and I'll try to get that to you. Okay.
That'd be great.
Or they could check with me or anybody. So
okay.
Anyway,
and I might talk to you about a satellite location for that course.
Okay.
You just hang on, Tom.
I would love it, Jeff. You know me.
I'll teach it with you, Tom.
Chad, nothing would make me happier. I promise you, you would be awesome. You'd be awesome. I'm not just saying that because you asked me on your show.
Well,
shameless plug.
Yeah, shameless plug. Hey,
well, that was a shameless plug I put in earlier, but I figure while we're talking about teaching, so
I love it.
That's what it's all about.
Thank you so much for having me on your show. You're doing a wonderful job, and I can't thank you enough for that.
We love you for being on.
Thanks everybody for watching, and we'll get you the information on Tom's course. Have a great night, everybody.
Good night.
Good night.
Adios.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.